Okay, I think the participant numbers are starting to slow down a wee bit, so we'll just get started. So good morning and welcome, and thanks for joining us today. My name is Jackie Stevenson and I'm a Programme Manager at Health and Social Care Alliance Scotland, and I'll be chairing the webinar today. And I'm joined by my colleague Alistair Bruce, who's doing all the technical wizardry in the background, so you probably won't see him, but you'll certainly see him in the chat. We're going to hear today from Dr. Amy Small, who's a clinical advisor, and Tracey Stronach, Advice and Support Practitioner, both from Chest, Heart and Stroke Scotland, about the services that they provide and the support that they offer. We'll be using a webinar format today, and we aim to finish by 12 o'clock at the very latest. We are recording the session today so that we can make the recording publicly available for anyone unable to attend, but please be assured we're using the webinar format, so it's only our good selves on the panel that are visible throughout. We hope to have some time for questions at the end, so please do use the Q&A function at the bottom of your screen and ask any questions that come to mind during the presentations. We also encourage you to use the chat function if you've got any general comments, but please do keep any comments respectful, and we'll make an effort to keep an eye in the chat, and we'll feed in any general themes that start to show. So without any further ado, I'd like to welcome Dr. Amy Small to start today's session.
Thanks for having me. I'm just going to share a couple of slides. I've not got anything major, but just to give me some prompts. I'm hoping you can see that. There we go. So yeah, as Jackie said, I am Amy Small. I'm a GP by trade, and I'm also a clinical advisor for Chest, Heart and Stroke Scotland. And I'm going to take you a bit about a sort of a journey through how Chest, Heart and Stroke Scotland got involved with long COVID, and what we did and where we are now and what we're doing. And then Tracey's going to come on and talk about all the support services that we offer, and how we can support people living with long COVID. Excuse me. So I'll take you through the journey, and that really starts with a personal journey. So if any of you know me, you will know that I too have long COVID, and I first got sick in April 2020. I was working in general practice. I got sick at work, and over a 6-month period didn't get better. If you are living with long COVID, you will know that that's very much an up and down journey. And in those early days, we didn't have a clue what was going on. I got fever, I felt a bit unwell, I had aches and pains, I suddenly felt very breathless. And then I got all the rest of the gubbins that all of us know very well about, with tinnitus, migraine, hearing loss. I couldn't brush my kids' teeth because I was too fatigued. I had to have 2 hands to brush my children's teeth. They were 3 and 5 at the time when I got sick. And my husband also developed long COVID. And so over those first couple of weeks, we just kind of did what everyone did at that point, and we stayed at home to protect the NHS because that's what we were all told to do. And I'll never forget saying to my husband, watching my oxygen saturations drop, and saying to my husband, if I start speaking gobbledygook, that's because I've not got enough oxygen to my brain, and you need to phone 999. In what world do we live in that was considered normal? But that was considered normal, as many of you, if you got sick at that point, will remember. We weren't seen, we weren't looked after, we weren't supported because we were told to stay at home. And I think that legacy and that impact and that trauma that many of us suffered from that has had ongoing effects that have contributed to our illnesses. But on that journey, I was trying to seek some answers. I was lucky. I'm one of the lucky few that I was always believed. I guess part of that is being a healthcare professional. No one ever questioned me or my legitimacy with long COVID, which I think a lot of people have experienced. And that's what we've heard from a lot of people living with long COVID, is that people didn't believe them. Doctors didn't believe them. People didn't, there was nothing there for them. People were just told, well, you're a bit tired, just go back to work or whatever. And no one really understood what we were all going through. I was lucky, I was believed, and I saw specialists, and no one really understood it. I had all sorts of blood tests and all sorts of scans and everything, and everyone just went, oh, yeah, you'll probably get better in a bit. But there wasn't anything there. There was no treatment. There was no kind of specific support. So what did I do? I took to Twitter at that time. I was lucky through all my other work that I had a relatively big following on Twitter, and I posted and I just said, all of you people out there with like ME and chronic fatigue. How did you get better? Because I've got this thing that we're all calling long COVID, but no one really knows what to do with it. And I started to get advice from people on Twitter about what they've done, seeing nutritionists and pacing and other bits. And I kind of started to realize that, this wasn't just going to go away by itself. I'd heard of pacing, but I didn't really know what pacing was. I thought you just did stuff more slowly and didn't really understand the concept of what pacing meant. And so I went off and did a lot of reading, and I was lucky that I was in a peer support group for doctors living with long COVID. And that peer support was so important to me. That was the bit that kept me going. That was the bit that really being with other people that really understood what was going on, really understood what it was like to live with this condition that no one really understood, but that was just draining the lifeblood out of me and my husband, and also having to look after children, etc., during a pandemic when you couldn't get help and there was no one there to support you. So I started to do what I've always done when in these circumstances, doing a bit of advocacy. And so I was being more and more vocal on social media about, what was the government going to do about people with this long COVID? What were they going to do to support people living with long COVID? On a personal journey, what were they going to do to support doctors who'd got sick at work during the pandemic? If any of you know my story, you will know that I was off sick for 6 months and therefore I lost my partnership. GP partnerships are a bit weird, but they had the right to expel me after 6 months of being off sick, and they did. So I lost my job. So at that point where I lost my job, my husband's salary was about to halve because he was also off sick for more than 6 months. Our roof was literally leaking into our kitchen. I sat there watching this drip come through the ceiling with potentially no income on my side, half an income on my husband's side. I had a kid in full-time nursery, another kid at school, and our mortgage was up for renewal at that point. And I just thought, God, my life is just... So I started writing letters, and I wrote a letter to Jean Freeman, who was then the Health Secretary in Scotland, and I said, what are you going to do about this? Like, what's the NHS going to do to support all these people living with long COVID? And what are you going to do about all the doctors that got sick and are now losing their jobs? Because I was the second of GPs I knew in the UK that lost my job, and there have been many, many more doctors and other healthcare professionals and others, of course, that have lost their jobs as a consequence. And she invited me to a meeting, which ended up being in January 2021, and I was there at that meeting, and I was there advocating, and at that meeting were people from Chestnut Stroke. So Jane Claire Judson, our CEO, and some others from the organisation were there, and they were bidding for funding. Because and Tracey will come on to talk about this, but what we do at Chestnut Stroke is we support people living every day with breathlessness, fatigue, all the other things. So all the stuff that we've learned through people that we support through stroke, chronic heart disease, any chronic condition, basically, we knew that we had the skills to support people with pacing. Like many, I didn't know what it was and needed support with that. And we also offered peer support. So I've already mentioned how I got so much support from my colleagues with that. And that's something else that we could offer at that point, was helping to set up peer support groups. So I was there just chatting about what I thought, and then Chestnut Stroke were there and bidding for some funding to help support the advice line, to increase our staff numbers, to support people living with long COVID, because at this stage we could see the numbers really going up. And after the call finished, suddenly I got a phone call from Alan Cowie, who was working with Chestnut Stroke, going, "You seem to know a lot about long COVID. Do you want to do a bit of consulting for us?" And that's how I got involved, and that's how it started, because I'd started to learn a lot about the sort of medical aspects behind long COVID. And so one of the things that I did was work really closely with the advice line in those early months, years. Work really closely with the advice line, looking at the more medical aspects of long COVID. So one thing that we had learned alongside this was that actually many people with long COVID were probably living with conditions such as POTS. So that's a condition where your heart rate goes up too high when you stand up, and it's often a consequence of a post-viral infection. One of the things I learned was people with ME were having POTS, but POTS isn't largely recognised. And sadly, in Scotland, there are no POTS pathways. There are no any health board in Scotland, one that manages that. I'm working on it. So I did quite a lot of education with the advice line around POTS, because this was new to them. We talked about other conditions such as MCAS, which some of you will have heard about. We talked about all sorts of different medical aspects, and of course all the psychological stuff, because in those early days, I don't know if you remember, there was funding from government for people who were on ICU because they had post-traumatic stress disorder. And actually I was saying, well, loads of people who are at home have post-traumatic stress disorder because they didn't get that support that they needed at that point. So there were people at home who wrote goodbye letters to their friends and families with COVID, but never did end up in ICU or never did have any of those things, but they were really ill. So I think, it was just about trying to highlight those things. And the advice line were amazing. They could have soaking up all this stuff and were so keen to learn about it. And they all went off and did their own kind of reading. And I know that that's something that whenever we've had people calling in who've had concerns about POTS or other bits, the advice line team really are well versed in it, know how to support patients in seeking further advice for that. So part of what we were also doing at that point, and I kind of joined after that project had started, was a digital pathway pilot in Lothian. So we had people that we were working with in NHS Lothian and Pogo Studios, who at the time were doing tailored talks. So this was like a sort of a PowerPoint presentation almost, but tailored to a patient. So you would get a questionnaire about your long COVID. We were trying to keep the questionnaires really simple, really short. We knew that people were really fatigued. We didn't want to go into loads and loads of detail, but trying to highlight where the issues were. So if let's say you had really difficulty with your brain fog and fatigue, then you would get sent tailored talks just to your problems and not the other ones. But if you wanted to read the other ones and you had the energy, that you could. And over time, we adapted them. We added voice, we added video. They were all co-created with people living with long COVID and our staff. And then it fed into, if you did that, you then got fed into what we call case management at Chest Heart Stroke, where you then got followed up for a good sort of 3 months, one-to-one with the same person. So you had that continuity of care. If you needed it, you could have it for that time. And that pilot, it was a pilot, and we're now looking at how we involve that in across Scotland, not just about long COVID, but all our other things. So things are changing a bit. But I worked very closely also with Lothian in terms of providing sort of long COVID support. And I know that each health board has done something different, but that's, I've had very close liaisons trying to work out how they can support people living with long COVID. There was then the Long COVID Strategic Network, which the government set up in terms of how they were going to support people on that broader level. And so I've been involved with that from day one. Actually, even before that, I was involved in a task and finish group that Jean Freeman had set up for how we were going to support people living with long COVID. I'd forgotten about that. But all the time, my voice and others' voices from Long COVID Scotland, from Long COVID Kids, we have been regularly meeting with government, trying to hold them to account, to try to get them to support people living with long COVID and provide funding. And it's been really difficult. And I guess that's the thing, you often feel quite left behind, especially those of you who got sick early on in the pandemic, for people who got sick right at the beginning, those with long COVID. I think it's a cohort that feel largely abandoned. And I think I just want you to know that there are still those of us who are still fighting. We might not get what we really feel we need, but we are still advocating for you, and Chest Heart Stroke has had a big role in that, and we continue to do that. We did release our 1 in 5 report over a year ago now, and where we surveyed people living with all of our conditions, but we did release a report called the 1 in 5 on people living with long COVID, and that has been used and quoted time and time again in terms of advocating for people living with long COVID. Government use it, other organisations use it. If you haven't seen it and you want to go away and read about it, you can just Google 1 in 5 long COVID chest heart stroke and it should hopefully come up. But yeah, so that's other work that we've been doing in terms of advocacy and trying to hold government to account in terms of the support that you will need. And then I also sit on the long COVID cross-party political group, which still continues to run, which is co-convened with Jackie Bailey, MSP, Sandesh Kulhani, MSP, and Alex Cole-Hamilton, MSP. The three of them continue to do that, and we continue to meet. And then, as I said earlier, I meet regularly with Long COVID Scotland, and I have good working relationships with some of the other charities as well, Long COVID Kids, and we do all touch base with each other. So it's sort of just chat, but it was kind of it helps to set the scene in how we got involved and what we continue to do. And really, I'm going to share this slide with you, and Tracey's going to go into some of this in a bit more details, but I'm happy for you all on this, you can click on these links and it will take you to all the different things that we offer. So we have everything from kindness, which is a bit like a befriending service or support service, to health defence, which is primary prevention for heart disease and stroke, and secondary prevention, but also that includes long COVID. So if you're having issues with your blood pressure or weight or whatever, these are things that we can support you with. The physical activity team, they've all been educated in post-exertional malaise. So they understand that graded exercise is not appropriate for people living with long COVID, but that some movement can be helpful and they know how to work around post-exertional malaise. So I always try and make sure that we highlight that. Yeah, I think I will stop there. I'm always happy for people to contact me. Again, I'll share this, so you'll get my email address. I've got a new little Instagram account where I'm trying to share helpful videos for people, and there is some stuff on long COVID there, on living with long COVID, and little tips and tricks that you can use. And I don't really use X much anymore because of who, but there is a lot of historical stuff on there on things that we have been doing. I will now hand over to Tracey. And do think of those questions because we're happy for Q&A at the end.
Thank you, Amy. Thank you for your talk, and thank you very much for inviting me along today, and thank you to everybody for coming. Now, I'm now going to try and set up my slideshow, so just bear with me while I do exactly that. Can you see that okay?
Yeah.
You can. Thank you. Hope that'll move on to the next slide. So I am part of the Advice Line team at Chest, Heart and Stroke Scotland, and I've been with the charity since May 2021. So really the early days of when the long COVID support was being offered. My background is as an occupational therapist, and I'd worked in the NHS for 29 years before having a wee bit of a change and coming to the Advice Line. So it's been a very different skill set, but great to use hopefully some skills excuse me, in supporting people that come to us for help. On the slide here, you can see two of my colleagues, and these are not models, these are real Advice Line practitioners. I don't know if there is anybody on the call today that has been in touch with us, has had case management, or who has had a reactive call, but there's Pamela at the top, and there's Alan as well too. And this is pictures taken before we had our uniforms. We've had uniforms issued to us this year, which I'm wearing today. And that's to help us to get the branding out and to get the message out that we are here to support. Because I still think there are lots of people that don't know what Chest, Heart and Stroke Scotland do. So I just think it is so important in getting the message out to people that we are. So obviously, as the name suggests, we are Chest, Heart and Stroke Scotland. So we do have our chest, heart and stroke support. And we also offer now out-of-hospital cardiac arrest support as well. So it's almost like we have 5 conditions that we support. But obviously today I'm going to be talking to you about how we support people living with long COVID. Now, the Advice Line, actually, it's a very special year for the Advice Line because we are 30 years old today. And apparently long before my time, but it was a very, very small operation with just one nurse on the line. And that has grown in recent years. And as Amy said, there was extra funding found to fund extra staff on the Advice Line, and I think that's probably where my role came from in 2021. So it is our 30th anniversary, and there is going to be quite a lot of media releases and support again to get the word out there, to publicise and to let people know what we can do and how we can help. So do keep your eyes peeled. We should be coming out to social media soon. So as Amy said, in 2020, long COVID was added as at that time a 4th condition. And I think our service has grown and developed since then. We've been very fortunate in having the support of Amy to help us with all the medical background. It was still also new back then, and we still have so much to learn at this stage. It's still very early, but I think we have come on a long way in the last 4 or 5 years. And one of the things I like about this job is that I get to share what I know to help people, but equally the people that I speak to give me information and I can learn from the people that I'm supporting as well too. So I do think it is very, very much a two-way process. So that's our history. So a big year for us this year. We're also actually working towards helplines accreditation for our partnership working. We have 2 strands to the Advice Line. We have incoming reactive calls and we have our case management calls, and we'll go on to talk a little bit more about those in a wee bit more detail. So the Advice Line, we are 6 qualified healthcare practitioners. So when I came to the team, it was mainly nurses and we had 1 paramedic, Alan. And actually over the last few years, that team has diversified quite a lot. So we have at the moment, so there's myself as an OT and there's another OT. We've got a paramedic, we've got 3 nurses, and we've got a pharmacist as well too. So we actually now have quite a diverse pool of hopefully expertise. We are all required to be state registered with our professional bodies and councils, but on the advice line we work generically. So we work with the title of advice line practitioner. We all work remotely from home, and we keep connected during the day by web chat, which is really important from a lone working point of view. But, you know, if we have any questions or need our team colleagues to help us with anything, then literally at the click of the button, we've got somebody there that can support, which is really, really good. We do occasionally meet up in person for the odd meeting at our headquarters, which is in Hanover Street in Edinburgh. And it's always really nice to see people in real life, but mainly during the week, we are in touch through Teams and web chat and so on. So we are a Monday to Friday service at the moment. Our lines are open from 9 till 4 and all of our calls are free. Outside this time, we do have an answer phone, we have an email facility and we have a text message facility as well too. And if any messages are left out of hours, then we'll get straight onto them the next working day. It is important that we keep up to date with all the different developments, and we're very grateful to Amy for keeping us up to date with anything new that we need to know. And equally, it's great to know that we, at the click of a button, we've got somebody there that we can ask our questions to. So we are continually pestering Amy with for requests for support and advice, and she's always very generous in getting back to us, and that's really good. So we do appreciate that. So as I said, we have two different strands of support. So we have our advice line number, which you might have seen. So that's our 0808 number, our free phone number. So if somebody calls that number, that's a one-off call, and the calls are anonymous and confidential and aren't documented anywhere. It's up to people if they want to share their details with us, and that's fine. So people can phone and come through to an advice line practitioner, and we can talk about anything that the person wants to talk. So it could be, in the case of long COVID, we have people that maybe have symptoms and aren't sure if they have long COVID. So we'll signpost them to go and speak to the GP. We can send out guidelines that can help with supporting those discussions. We can talk to people about how to get the most out of an appointment with a medical practitioner. I think, as Amy alluded to, in the early days, a lot of people didn't have their symptoms believed or taken seriously, and so many of our calls were themed around that. I do think it's a lot better nowadays that people are much better informed and willing to listen and consider long COVID as a possible diagnosis, so which I think is very, very positive. We can support people on the phone for 5 minutes or for an hour. We have the gift of time that we can take to unpick whatever is going on for that person. And the way that we arrange ourselves during the team is that we all have a day of reactive call duty. So we have clear calendars that day, and we're literally just there to take the incoming calls. Whereas on other days of the week, we're there for our case management calls. So for our reactive calls, we will go through symptoms, we can go through anything related. So we can go through anything from getting a diagnosis, managing symptoms such as fatigue, shortness of breath, brain fog, work-related issues, sometimes relationship-related issues as well too. Many people are of working age, often people with childcare, and often people supporting older adults as well too. So there's often many offshoots from our calls. People can be quite emotional on the call, so it's important to give the person time and space to talk things through. We will always follow our calls up with an email with links to all the different organisations that can help, all the external services and also our internal services as well too, because we do have a lot. And Amy's slide gave a really good flavour of that indeed. After the call, if we feel that somebody could benefit from ongoing support, then we will offer that. We will offer to develop the call into a case, and then we can offer regular callbacks to the person to work through symptom management over a number of weeks. But sometimes one call is enough. And we always say to people, you can call back at any time. It doesn't matter, if it's something that's very recent or relating to, a year trying to get a diagnosis, we're here at any stage. And we do cover all of Scotland. We do get calls that find us from other parts of the UK and sometimes from abroad, and that's okay. We'll talk to anybody. We will never turn anybody away. Obviously, for our own services, we are limited to sharing those with people that just live in Scotland, but there's a lot that we can do with signposting to people that call not from Scotland. So that's our reactive calls. We also offer, as Amy said, we've got our case management calls, and they come to us from different referral routes. So they can be developed from a reactive call, or we did used to have our tailored talks portal for NHS Lothian, where GPs could refer into that and receive a slideshow of talks and opt to have a call with ourselves, and we would take people on for case management and offer regular calls to work through all the different issues. Some people come in at far less than 12 weeks, and I'll be honest, some people come in at a lot more. You know, I don't think everybody neatly fits into a 12-week programme, and I'm always really pleased to be able to offer that flexibility for people. So with case management, our calls are by phone. We have recently started offering video, so that's quite new, hence the uniforms, so that we can get out there with our branding and our image. So I think a lot of people are actually quite happy with phone calls. I think there's something about that comfort and safety of anonymity, and again, maybe somebody doesn't have to concentrate quite so much on pictures. Maybe phone is easier for some people, but it is good to be able to offer the two different options. If somebody can't manage calls or a telephone, then we can email out information. We've had people that we just relay that way because their fatigue is too profound to manage on a call. So we will always try and tailor our input around the individual and what they need to have. Our calls for case management could usually around half an hour, obviously very mindful of fatigue, which tends to be the top symptom for most of our service users. So we will try and keep things on the shorter scale and then follow up with email so that they don't have to remember everything that we've said, because we can cover quite a lot in that time. So we do a lot of signposting to external and internal services as well too. And I will move on to what else we offer. Here we are. So I should say for our case management, we do have a goal setting ethos. So it's important for us to find out from the caller what is most important to them, which symptoms would they like to focus on. So as I said, that could be anything from fatigue management, managing breathlessness, emotional well-being, sleep hygiene, perhaps sometimes work-related issues. It can be very, very wide and very, very broad. So we document our goals, and then we can review those regularly with our service users. The first call that we have with the person tends to be the longest, obviously, just to get a background of what's been happening on in their lives, what's happening now, what are the symptoms, what is the impact, where would they like to be. As I say, we can go beyond the 12 weeks kind of unofficially with that as well too. Even at point of discharge, we always say to the person, it's very much an open door. They can come back to us at any point. We make sure that they have our email address and our phone number, and we do get people that come back to us at different stages of their condition, and that's always really good to know that people trust and value the service enough to want to be in touch again, which is really important too. So the internal services that we would use in our organisation. So, and it does depend where you live in Scotland. The face-to-face services are different depending on where you are, but we do have a mix of face-to-face and online services as well too. So hopefully there's something for everybody depending on where you live and what you need. Our community support services are aimed at helping people with activities and connections. It can be one-to-one support with goals. We don't have face-to-face in all the areas in Scotland, but most of them do. And we can signpost to the right team there. We do have peer support. Now, it has changed recently for our long COVID support group. We did used to have a dedicated group, which it's changed now to be a little bit more arm's length. And there are some support services which are affiliated to the organisation, and there are some which have kind of moved to be standalone as well too. Like I know that there's a Facebook group too, and I think there are more organisations that are hoping to come on board with that. So we can signpost to any groups that we are aware of, both online and in face-to-face as well too. We have a kindness caller service, which is good for people that are socially isolated. And that's a telephone befriending scheme which lasts for about 12 weeks. And again, I think if the person needs help beyond 12 weeks, then they may have a different volunteer to work with them. So that support is there. So that can be good for some people. We've got a mixture of physical activity offers. So we have our online classes, which Amy was telling you about. And these are gentle classes with experts in fitness. So it's going to be a safe place for people to exercise, and the onus is always on safe movement and not pushing, just being very sensible and respectful of individual personal activity. So these classes run every week, and they're online, so they're accessible to anybody that can manage with a computer. We've also got some in-face activities at our hub in Maryhill in Glasgow, and there are walking groups as well too, gentle walking groups, health walks, if people are able to manage that kind of distance. Obviously physical activity, it's got to be looked at within the whole envelope of energy, so it's not going to be suitable for everybody, but even if some people are able to take part in even part of a class, it can be good for activity levels and connection as well too. The emotional well-being, I think, is a huge part of the support that we offer. I think particularly, as I said, when I started 4 years ago, and so many callers were just disenfranchised and not being believed, not being listened to. So helping people to have the courage of their convictions and go and start those discussions again, and give them some tools to go ahead and to get the diagnosis that they needed to get. It's such a life-changing diagnosis, and that's so evident from everybody that we speak to, the changes that it means for family dynamics, for working, for financial impact, to name a few, being able to get out and about. So we do work with people trying to build resilience and reframe. One of our internal services that we have is actually psychology. So we can refer people to our psychology service, which is run by students from the Glasgow Caledonian University. They offer a set amount of sessions, and that can help with acceptance and commitment. It's very much a cognitive behavioural approach, and I think that works well with everything else that we offer. So it's good to know that we have that. We have quite a lot of resources online. We have all of our leaflets. We have some special long COVID booklets, and we have lots of related ones on different lifestyle issues such as managing fatigue, finances, work, mental well-being, exercise, diets. There's heaps there. So people can see our publications online, and they can also request hard copies as well too. And everything is free. Everything that we offer is free, which is really good. Last post, we do offer education. So obviously our session today comes under that umbrella. We do quite a lot of external engagement events. So if there's a conference or an event on, we'll go out and we'll man a stall so we can speak to people and try and get the word out about what we do, and encourage more referrals or people to phone us in. So it's really important to be doing these kind of non-clinical activities as well as the clinical ones that we do. We also have supported self-management classes in some areas in Scotland, and that's being rolled out. And these are largely lifestyle, looking at sleep, well-being, mood, and we have a practitioner that works with people in these matters. So we do have a lot, and it changes all the time. We think we're quite a proactive organisation for organising different things, and things change from week to week. So we need to always keep abreast of everything that's happening. So these are some of our internal things that we'd refer on to. External could be anything. It's just a coincidence that Alliance is at the top of the list there. This list is a small part of the organisations that we signpost out to. We've got financial organisations that we get in touch with, mental health organisations, signposting people to reliable sources of information. As we know, the internet is full of information, some good and some less so. So we always direct people to evidence-based websites and reliable places to get information. And we will always try and signpost people to local organisations that can help as well too. So we do cover the whole of Scotland. We obviously we don't know everything about every service everywhere, but we are very good about searching and researching on behalf of our service users and giving them that information that they need to. So as I say, there's plenty other places that we do signpost to as well too, but this is just a selection there. So I mentioned that the advice line is developing all the time. So we have our clinical side, but we also have a non-clinical side as well too. So our Living Well coordinator, Kirsty, I've described a little bit about what she offers. We've also got a cost of living coordinator who's quite new in post. She's not there to do financial assessments, but she can signpost people onto places of support. And a very recent addition to our team is Caroline, who's our Know Your Rights coordinator as well too. So I think it will be interesting to see how Caroline's role develops over the weeks and months to come. It's important to get feedback. So hopefully this gives you just a little representation of some of the things that people have said about our service. I think on the whole, people do feel it's valuable to have support, whether it's a one-off call or whether it's through a series of calls. It's good for people to share, to offload, debrief and get reliable advice and support and information and tap into our services. And here are our contact details. So just whatever suits people best. So most of our contacts come from the free phone number, which, as I said, that's live Monday to Friday, 9 till 4. On our website, we do have an online referral form and there's an inquiry form as well too, which is quite simple to fill in. So sometimes we get our referrals that way. There's also a professional referral form as well too, which is much the same. You can text in on the number there. If we get a text, we do generally text back and ask for permission to phone, because there's only so much that we can do in a text, but it is a start, it is a foot in the door. You can email us on our advice line email address there, and you can keep up to date with what's happening with the organisation on all the usual social media outlets there. And finally, thank you for listening. I hope I've covered everything today, but we'll be very happy to take any questions that you might have about what we do or any suggestions. So thank you.
And thank you, Amy and Tracey, for sharing information today. There's been a flurry of activity in the chat and in the questions, so can I take some of the kind of comments and questions in no particular order? So there's been a couple of kind of comments and questions just around a lack of awareness that Chest, Heart and Stroke Scotland can provide support for long COVID, and again just kind of suggestions around how might we be able to share that information more widely, and also whether GP practices are aware that you do that as well, and whether they're able to signpost to you guys.
So if anyone that's ever met me will know that the first thing I did when I got to Chest, Heart, Stroke Scotland is say GPs don't know about you, because when I was a GP in East Lothian for many years, I knew about the shops and that they had the best clothes ever, but didn't know anything more about the organisation. So a big bit of what there's been a lot of change within the organisation in the last couple of years, and a lot of development, and we're doing a lot of what we call partnership working and external engagement, and there's been a real big push on that in the last year and a half. Finally, people are listening, and so we are. One of the big projects that I'm leading on at the moment is getting us seen in primary care in particular, because the vast majority of us will be going through our GPs. So we're hoping in the autumn to launch kind of like a primary care package. This is what we do. This is how we can support your patients. We all know that the NHS is under a huge amount of pressure, and where GP can offer you 10 minutes, as Tracey said, we can offer you half an hour, 45, an hour, whatever it is that you need, and we can plug those gaps. So I've been doing a lot of work throughout my networks ever since I've been involved with Chest, Heart, Stroke, but really trying to build that up now on a much, much bigger scale through health and social care partnerships, through health boards, through everything, trying to get that voice out there that we will support you. Advertising campaigns are always tricky because they cost a lot of money, etc. But we are, and our focus in the last few months has been on our FAST campaign around stroke, but we are constantly looking at what it is that and how we support people. So please just get out there, tell people that say, oh, you got long COVID, phone Chest, Heart, Stroke. We do heavily rely on word of mouth, but I am getting out there. I'm getting out there to primary care. We have got a couple of what we call a few health defence hubs. So we've got one in Maryhill. I always forget the other one.
It's Dundee.
But the other one that's near Maryhill, the Glasgow one, the other, the original. Anyway,
Yeah.
Dundee, and then we're opening one in Aberdeen in September-ish. So again, hopefully as those things open, then more people locally get to know about us. So it's a work in progress, but just, we are open. So just keep sharing that message to whoever you speak to. People can just get in touch with us and tell your GP. If your GP doesn't know, go, oh, did you know about chest heart stroke? Tell the receptionists, tell whoever, we're there to support you.
Thanks, Amy. We've got another question that came in from Richard Jones. Are Chest, Heart and Stroke Scotland still working with Pogo Healthcare?
So our partnerships come to an end now. So yeah.
And Tracey, this might be relating to, you mentioned you have a new cost of living coordinator. So we've got a question around, do you have team members who can support or help long COVID sufferers complete ADP forms, or can you signpost to the correct place?
Yeah, so the support that Katie will offer will be signposting to other organisations. She doesn't go through the forms with people, but she will signpost on to places of support. One of the main places that we signpost to is Voiceability, who are excellent at supporting people with all the corrective paperwork. And we'd also signpost to citizen support as well too. But unfortunately, Katie's not there to do the forms. Whether that might be a future development, I'm not sure, but at the moment it is just signpost.
And we had a few comments in the chat just around that some of the changes to support groups have meant that numbers have kind of dropped off a wee bit. So I just wondered if anybody wanted to comment on kind of peer support more generally and how folk can access peer support locally, because I think there's a few comments in the chat just around the different areas folk are living and that there's nothing in their particular area.
So the original peer support group that we'd set up was very much hosted by us, and our model of peer support group is to help people get them up and running and then get them out so that people can run them locally. We don't have the ability to continuously host peer support groups, but we help people set up their own. So that model we've tried to evolve that group. So what I would say is there are about 300 people that at some point had gone through that peer support group. And so to reassure those that feel that they're being left behind, for anyone that was agreeing to it, we have contacted every single member that agreed to it, and they've been offered one-to-one phone calls with Advice Line to let them know what other stuff that we offer, and there's been quite good uptake on that. I think some people hadn't realised that we were still going with some of those things, and that we've also happy to help keep going with setting up peer support groups. So I think there have been little offshoots, and there are some other bits that are coming around that. So that might not be the one big group anymore, but I think there are several smaller groups that are being set up. So if anyone in your area you feel you haven't got that, either physically or online, please do contact peer support, because we will help you set that up and get that running. We do understand the issues with fatigue and how that can make it challenging, but there are ways and means to get those things up and running in a way that we can support you. So that peer support is very much it is still there. We understand the difficulties, but that there are ways and means to kind of come to terms with that. Do reach out if it's something you feel you haven't got in your area. And if you want to do something physical, I mean, I know the Just a Cuppa group, which I heard about recently, have been phenomenal in their area. And I think there's a few of you now, not just in Falkirk, if I've understood correctly. Yeah, it's just whatever. The most important thing is being able to talk to other people living with it. So, we want to be able to facilitate that in any which way we can.
Amy, I think this might be another one for you, just whether you've got anything you want to comment on. Just somebody's raised that changes to kind of local services that were available in NHS board areas, the example being given in Tayside, that service has lost its funding and they're now still struggling and look where to turn, I suppose, is the kind of underlying question there.
Yeah, so the whole long-term funding of these is really challenging, because when we first met with Jean Freeman and we were talking about, our service, we were supposed to be part of a jigsaw puzzle. So when we were talking about what we could offer at Chest Heart Stroke, I said from the beginning we're not the answer, right? We can't fix long COVID. We need doctors. We need people who can make diagnoses, who can treat with medication. And we made it very clear that we will be a support service in addition to anything added, anything that's available within health boards. And Jean Freeman was very clear that it was going to be a once for Scotland approach. She wanted it to be once for Scotland, and everyone, whether you were Barry and Barra or Barry and Bathgate, you would get the same service. And 'twas ever thus, it's always the issue, haven't we got with rurality and different, you know, health boards, and everyone does something different. And lo and behold, they create the strategic network, they get the government get the money, they throw it out and they go, right, it's down to the health boards to do what they want. And that money was never enough. The money was never enough to employ doctors. And the problem was it was on an annual funding basis. So if you're setting up a service and you go, oh, great, so you get the money in April, and then you want to employ someone, but you can only guarantee their income for 12 months. I mean, and some areas haven't been able to recruit at all. So I know that Fife have had a huge problem because they couldn't get anyone to work for them, because, you know, you're never going to get anyone more than a 10-month contract. So this was a huge difficulty that we faced, and we've been very critical. I would say I've been very vocal. The other charities have been very vocal about the fact that there hasn't been, you know, a good sort of long-term plan. So where does that leave us? They've now kind of merged it into chronic disease management. They're certainly looking at sort of post-infective illnesses. So we're thinking about all the people with ME, chronic fatigue syndrome, fibromyalgia, other conditions that are not dissimilar, and a lot of the support that we offer, you know, you can replicate across those conditions. And I've been very clear with government that what we need to do is not drop people down to the level of ME, but bring everyone up to a higher level and support everyone at a higher level. And again, that's really patchy. So Lothian's always had an ME service, but it's never had a doctor for the last, I don't know, 15, 20 years. It's not had a doctor as part of that service. So we are continuously advocating for the fact that we need to have all health boards providing, you know, medical support for people living with the condition, along with the AHPs along there. So it's a really difficult one, and it's one that we have to just keep fighting for. It's not ideal, and we always knew that that was going to be the case, and it's just really frustrating. And I just have to say on behalf of you all, anyone that's ever been in a meeting with me know that I've said the same thing now for 4.5 years. October 2020 I started banging on about this with government. You know, I think it's really frustrating, and I think a lot of people give up. They stop going to their GP, they stop seeking help because they feel like, well, there's nothing there, and they're going to be told it's the same thing over and over. So again, keep contacting us, because the more we hear from you, the more we can advocate on your behalf, and we can go, look, we've just had, you know, 50 people phone us and go, from Fife or wherever. And that helps us, because the advice line do tell us what they're hearing, they do tell us what they're seeing, they tell us, and then we can use that moving forward. So again, if you've not read our 1 in 5 report, please do go off and have a look, because I think you'll feel seen and you'll feel heard, and know that we are still fighting for that. But it's shit. There's no other word for it, and I feel a deep empathy for everyone living with it.
Well, on that note, again, just to thank everybody for joining us today, especially yourself, Emmy and Tracey, and all of you for joining and participating and asking your questions and commenting in the chat. It was good to see there was quite a bit of kind of peer support happening in the chat, as well as several of the folk joining the call today think resonated with yourself, Amy, and kind of shared some information about being diagnosed with POTS and kind of other strands of what they're experiencing due to long COVID. So again, thanks, Amy, for sharing your very personal story as well, because I think it's really touched a lot of the folk that attended today. As Ali mentioned earlier, we have recorded the webinar, and we will be publishing it on the Alliance YouTube channel, and we'll be back in touch again as soon as that's available. We do hope to have some other webinar sessions over the next few months. So if you've got any ideas for additional topics that you would like to have some more information about, please do reach out and let us know, as we're happy to consider what you guys would feel is of more benefit. So feel free to email us here at the Alliance at longcovid@alliance-scotland.org.uk. But other than that, again, just round up by thanking everybody today for your contributions, coming along. And again, do not hesitate to reach out and get in touch with us, or Amy or Tracey, and check the colleagues at Chest, Heart and Stroke Scotland if there's anything that can do. There is some support there for you, so don't hesitate to reach out. And hopefully we'll see you again at a future webinar. So thank you very much.
Thanks, everyone.